The World Health Organization's Cancer Agency have issued a dire warning about the staggering rise in new cancer cases. By 2050, the number is projected to soar to over 35 million, a shocking 77% increase from 2022 figures. The International Agency for Research on Cancer, IARC, pinpoints tobacco, alcohol, obesity, and air pollution as major culprits behind this alarming trend. Developed countries are expected to bear the brunt, with nearly 5 million more cases anticipated. Countries with lower Human Development Index scores will experience a huge 142% increase. Now, this surge will strain healthcare systems worldwide, especially in regions that are least equipped to handle it. And to talk about this, I've been joined by a clinical and radiation oncologist, as well as a senior lecturer at the College of Medicine, University of Lagos, Dr. Omolola Salako. Good afternoon, Doctor. Glad to have you join me.
Good afternoon. It's a pleasure to be here.
The pleasure is all mine. Now, from a clinical perspective, what strategy would you recommend in addressing the rise in incidence of air pollution, alcohol, and also tobacco abuse to curb cancer incidences?
So air pollution, for a start, is when the air we breathe is polluted with chemicals, physical agents, or biological agents. And it's important to note that there's a rise in air pollution, which is contributing to a lot of diseases like cancer, chronic respiratory diseases. Now, one way we can battle this from the clinical perspective is for us to continue to educate the public on reducing their exposure to air pollutants, just starting from home. People who use stoves, kerosene, the fumes generated from such devices or, equipment should be reduced significantly. And if you must use it, make sure you're using it in an area where there's a lot of aeration, doors and windows are open, so that you're not taking the intensity of the fumes. Secondly, the way we can tackle it is around screening and early detection programs or initiatives for people who have a high risk. For example, people who smoke have an important risk factor that predisposes them to all types of cancers. For one, tobacco, when inhaled, as cigar or ingested as betel nut, or through the shisha pipe, it allows the system sort of gets addicted to this tobacco because there's nicotine in it. But tobacco also suppresses the immune system. More importantly, tobacco damages the cells and predisposes people who smoke for a very long time to lung cancer, breast cancer, cervical cancer, and so many other cancers. And so for people who are smoking, it is important they are exposed to smoking cessation programs, behavioral interventions that help them get off smoking, because it becomes an addictive habit.
In situations where cancer patients... Yes, I know you've talked about those predisposed to coming down with cancer, but then are there any dietary or lifestyle modifications that can help reduce the risk of developing cancer?
Oh, definitely. 40% of cancers are preventable. So, for example, colon cancer, which ranks as the fourth commonest cancer in Nigerians, is one cancer that, it occurs for some people because their diet is heavy on fat, heavy in fat and oils, low in vegetables, low in, the important nutrients that actually help the cells stay healthy and repair themselves from damage. So having a diet rich in fruits, vegetables is crucial in reducing the risk of colon cancer. And then limiting processed foods like bacon, sausage, and anything you just can't, that is processed, reduce the consumption of that.
Now, what are the most prevalent forms of cancer common in your field of practice? Just to help us understand how they are potentially tied to environmental exposures, and even how can one, or how can one be equipped, to try to tackle these cases and nip them in the bud before they grow beyond control?
So here in Nigeria, the top 5 common cancers, breast cancer is the most common cancer globally, not just in Nigeria. The second common cancer here in Nigeria is prostate cancer. The third is cervical cancer. The fourth is colorectal cancer, and then non-Hodgkin's lymphoma. But we also are, seeing the rise of colorectal cancers. And some of these cancers can be prevented. For example, cervical cancer through screening, through the HPV vaccination, which the federal government has rolled out a vaccination campaign for young girls from age 9 years old. If they visit certain primary healthcare centers, they can get one shot of the HPV vaccine. And in future, when they are adults, say when they are 30 and they start engaging in sex, if they do get the virus, the HPV virus, they already have been vaccinated decades ago and they have a reduced risk of developing cancer. In practice, at Pearl Oncology, where I treat cancer patients, breast cancer is the most common cancer. Again, we do not know the reason why many women develop breast cancer, but some women have a strong family history of breast cancer where someone in their family had breast cancer. In fact, 3 to 4 people had breast cancer. And it's important that such families with a family history of more than 3 people should present to the oncologist, for preventive measures, especially for the younger children. There are certain steps that can be taken, like there are tablets we give to prevent breast cancer from occurring in families that have a strong history of cancer.
Just allow us a little more, into your field of practice. I mean, where do you see the biggest gaps in cancer? Is it in the prevention or early detection or even treatment capacity?
So I think I would take this from 3 approaches. From the individual perspective, in practice, a lot of patients come in scared. First of all, before there's cancer, we're now talking about cancer prevention. As you said, people are not screening. Women are not going for their pap smears. They're not doing their mammograms. Men and women are not doing their colonoscopies. Look, some cancers are forgiving, and when I say this, I mean that some cancers show signs, 20 years before they become full-blown cancer. And the only way we can detect it when it is so tiny, when it's so microscopic, is when people present for their medical checkup. But a lot of Nigerians and, people in low middle income countries are not presenting for their medical checkup because they feel, oh, I'm fine. I don't have any symptoms. Cancer doesn't run in my family. What am I checking for? And then people don't understand the benefit of screening and also cost of screening. It is, a bit pricey for people to prevent cancer and go for certain tests. But again, prevention is better than cure. In terms of treatment, people are scared of the cancer diagnosis. So we see cases here at Pearl where women have noticed the breast lump more than a year, but they've hidden it from their loved ones, from their relatives, and just because they don't want to help, just because they don't want the diagnosis, they suspect it's cancer. They go on Google, they search everything, they talk to other people, but run away from the place that can help them. So I would say fear is a reason why people are not screening, which helps us to prevent cancer. Fear is also another reason why people are not presenting to the hospital to start treatment very early. In the healthcare system, it is fragmented, it is complex, and we need better collaboration amongst the stakeholders.
All right, thank you so much for your time on the news, Dr. Omolola Salako, clinical and radiation oncologist. Thank you once again.